As we gather, we honor and acknowledge that the University of Colorado's 4 campuses are on their traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what we now call Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. With this land acknowledgement, we celebrate the many contributions of the Native peoples and also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. And with that, I'll turn things over to Myron, who will be introducing our speaker today.
Thank you, Cindy. It's my pleasure today to introduce Dr. Priyanka deSouza, who's our speaker. Dr. deSouza is Assistant Professor of Urban and Regional Planning at UC Denver, where she's joined the faculty this year, as well as a consultant for the World Health Organization. She received her PhD earlier this year from MIT, where she was a presidential scholar and worked in the MIT Sensible City Lab. She's won a number of other distinguished honors, including a Rhodes Scholarship, which took her to the University of Oxford, where she received both a Master's of Science and an MBA. Today, her talk is entitled Making Air Quality Count, Low-Cost Sensors, Public Health and Urban Planning. We're extremely glad, Priyanka, to have you with us. And I'd like to ask everyone to welcome Priyanka deSouza. Go ahead.
Thank you so much, Myron. Thank you for having me here. And thank you, everybody, for showing up after a long holiday weekend. Today, I'm going to give you an overview of my work involving low-cost sensors, public health, and urban planning. So why air quality? Air pollution is one of the biggest environmental health risks we face today. In 2019 alone, it was ambient air pollution and indoor air pollution was responsible for about 7 million premature deaths. I got involved in working and thinking about how to better the quality of our air when I worked for UN Environment in Nairobi. And when I joined, UNEP was given the mandate to help countries develop air quality management plans. The first thing we did was look at the data that different countries were reporting. And this is a map from OpenAQ, which showcases all of the publicly available official air quality monitoring data reported by governments around the world. And as you can see, there are huge gaps. In the entire continent of Africa, there are less than 10 air quality monitoring stations that provide public air quality information. This worried us because without data, how could we as the UN help countries develop air pollution management plans? And this map has driven the work that I did and the work that I continue to do. So the first set of my work is filling in the data gaps. How can we use low-cost sensors and satellite instruments to fill in our understandings of air pollution? After we have this data, how can we use this data for policy-relevant applications? But then after we have this data, after we've developed these applications, how do we ensure that the inequalities, how do we ensure that there are no inequalities in the production and access to this data that will then drive these policy decisions? And finally, how does data really translate into policy and practice on the ground? What are the barriers to political action on air pollution? I will be telling you a little bit about my work in each of these different buckets in my talk today. So part one, filling in the gaps. Why are there so few reference air quality monitoring stations or regulatory air quality monitoring stations in Africa? If you look at this monitor on the left, this is a monitor operated. This is a typical monitor operated by the US EPA. It's as big as a house. It costs a lot of money. This particular station costs $200,000, not including operating costs. But the data reported by these stations are very accurate. On the right, you can see a low-cost sensor, one that I deployed in Nairobi. It's small, it's relatively low cost, but the downside is it has lower accuracy. So no low-cost air quality monitor currently available actually meets regulatory standards, which means that the data quality isn't good enough for them to be used for regulatory purposes to uphold the air quality standards. Nevertheless, we wanted to explore what kinds of information can we use low-cost sensors for. The second part of my work was looking at satellite data. Why satellite data? I think this map is pretty self-explanatory. Satellites provide global snapshots of air pollution from 1998 till the present moment. This is actually a satellite-derived map of PM 2.5 developed by Randall Martin's group at the university, at Washington University. The problem with using satellite data is that satellites don't directly measure PM 2.5 or fine particulate matter, that is the quantity that is regulated. They actually measure another quantity termed as the aerosol optical depth, or the amount of light scattered and absorbed by particles as it passes through the atmosphere. That scattering, that AOD needs to then be calibrated to derive these ground level fine particulate matter concentrations that we care about. In order to calibrate satellite data, this group and other groups have used ground monitoring stations. Now, the problem is that most of these ground monitoring stations are located in the global north, and therefore, this paper, for example, has shown that satellite-derived PM 2.5 concentrations have much higher uncertainties in the global south. And although they can be very useful at a regional level, the data has too much uncertainty to examine intra-city sort of air pollution variability. And so this is the problem with satellite data, and the problem with low-cost sensors is they provide data with a lot of noise. I developed a technique to combine the data from low-cost sensors and satellite data for air quality applications. The beauty of such a technique is that it can then be used to derive higher quality air quality estimates in places without reference monitors, but where low-cost sensors can be more easily deployed. What I did was I looked at what low-cost sensors did best, and that is this low-cost sensor in particular. It's called an optical particle counter. Although it has large uncertainties in measuring PM 2.5, it's pretty good at reporting the number concentrations of aerosols in different size bins. Now, because it uses an optical technique to measure these aerosol number concentrations, it cannot detect particles less than 0.38 micrometers. But if under conditions of low relative humidity, the number concentrations in the size bins in which this instrument can actually see particles is pretty good. On the other hand, we have this particular satellite instrument called the multi-angled imaging spectral radiometer, which actually under certain conditions can provide pretty good size resolved information of aerosols down to 0.1 micrometers. So we wanted to use the information from MISR to constrain the size distributions derived from the OPCs. And then from this better size distribution, derive a higher quality estimate of PM 2.5. And I worked very closely with the chief scientist of the MISR team, Ralph Khan at NASA Goddard, to do this. So essentially, and I'm not going to walk through the math now, though I'm happy to talk about this technique later. We used the size distribution of the OPCs and the size distribution from MISR. We used the size distribution of MISR to constrain the size distribution from the OPCs to derive this higher quality size distribution. And using the network that I had deployed using the low-cost network that I had deployed in Nairobi, we actually found that this method looked pretty promising and has the potential to fill in gaps. I'm currently writing grants to do deployments in the US to actually evaluate our technique against other techniques that have been developed, and based on the results to scale up our low-cost monitoring network in the global South. The other project that I want to talk to you about is City Scanner, using mobile low-cost air quality monitors. I have a little video here. Let's see if it'll play. This was the mobile platform that we designed, and we had a bunch of sensors plugged in. This is the OPC, the optical particle counter that we used for air pollution. We deployed these monitors on garbage trucks, produced a map to allow citizens to play with the data, evaluate air pollution data on their street, compare it with other streets, as well as evaluate trends over time. We also had a thermal camera where we looked at building, I did not look at this, a colleague looked at building energy efficiency, and we had an accelerometer that we're using around the world to look at potholes. Sorry. Okay. Oh no. Let's advance. Okay. So why mobile air quality why mobile air quality sensing? Air pollution varies over distances as short as a few meters, and stationary air quality monitors cannot capture those variations. So we were really excited about exploring low-cost sensors on mobile platforms, but we wanted to work with the city to understand how we could actually use this data and help them make decisions. So we did this particular project of deploying low-cost sensors on garbage trucks in the city of Cambridge, along with the Cambridge Public Works Department. And we sort of asked them, what do you want to know? And the first thing they told us was they wanted to know where the hotspots were, but they were most interested in hotspots that persisted in time, the really big hotspots that needed urgent attention. So what we did was we evaluated the top, we looked at all PM 2.5 measurements that were above 50 micrograms per meter cube. Now, that's a pretty high value. Now, as I said, the low-cost sensors that we're using are noisy. So we needed to be able to differentiate noise from an actual event. In order to do that, we clustered really high PM 2.5 measurements that were made in the same 100-meter location. And the size of this spot indicates the number of days over which we saw the same really high values of fine particulate matter in the same 100-meter radius. And the color indicates the number of high measurements that were made in that same radius. So hotspot number 3, for example, was made over multiple days, and we saw multiple measurements of really high values in the same 100-meter location. And then we actually went to each of these spots that looked like, we were seeing some air pollution events over time to actually see what was going on and validate this technique. So hotspot number 3 actually corresponded to a huge truck transfer station in Roxbury, which is a poor neighborhood in Boston. And we actually found that residents had been complaining about this truck transfer station for a very, very long time. And this is what it looks like on the map. You can see the many, many trucks that sort of are parked here and start from here to pick up waste from the wealthier parts of Massachusetts. And so we were able to convey this finding to the city to tell them that they needed to do something about truck idling to lower levels of air pollution. We also mapped out the generalizable sort of PM 2.5 concentrations in Cambridge. In general, PM 2.5 in Cambridge is pretty low, and so was not as interesting, although we were happy that we were living in such a clean city. But in addition to mapping out PM 2.5, as I said, we wanted to make use of what these low-cost sensors could do best, which is giving us the number concentration of particles in different bins. So here I plot the number concentration of larger particles, particles having diameters greater than 1 micrometer and less than 10 micrometers. A high number concentration of these larger particles indicates a local source. This is because larger particles tend to fall out of the atmosphere faster. In fact, we all know this, given all of the COVID-19 debates. We know that COVID is transmitted from really, really tiny aerosols, which is why it's airborne, which is why we need masks. If COVID was transmitted using larger aerosols, then it wouldn't matter so much because those aerosols would deposit from the atmosphere faster. So a high number concentration of large aerosols indicates a local source that the city of Cambridge actually had control over and could do something about. So this particular spot here on Malden Bridge, I don't know if you can see my cursor, I hope you can. So this particular hotspot was actually located right next to Everett Casino construction, right here. And when we went there to validate this, we actually found that this construction was causing a large amount of dust in the atmosphere. So this is how we validated our findings and were able to say that the city of Cambridge needed to do something about these sources with confidence.
We can see your cursor, by the way.
Oh, great. Thank you. We also sort of clustered measurements if the size distribution of aerosol for each measurements was similar from the size distribution of the aerosol for each for the average size distribution for each cluster, we were sort of able to say what the major source could potentially be. So the purple indicated that there was a local source because we were seeing a mode sort of here, while we were able to sort of say that the lemon was most likely vehicular pollution, while the blue was most likely background aerosol, and therefore we were sort of able to say, maybe this is where you want to build hedges to protect pedestrians because vehicular PM 2.5 is a major source. So these are other sort of things that we were able to extract from these mobile low-cost sensors. In Cambridge, we used garbage trucks because they go everywhere, but the trucks were only on the road between 7 a.m. and 2 p.m. We actually have a partnership with the city of New York, and they wanted to know how many taxis do we need to install air quality monitors on to get a particular number of street segments covered in a given amount of time. So we did a bunch of simulations to evaluate how many low-cost sensors do we need if we want to put our monitors on taxi cabs. And we actually found we needed a fairly low number of sensors to get, 60% coverage, 60% spatial coverage in New York. But then if you want to get those last outer boroughs, then you really need to increase, then the diminishing returns of increasing the number of sensors sort of decreases. But we just needed a few to get a 60% coverage of the city. We currently do have a pilot going on with the city of New York with the mayor's office, and for our pilot we have low-cost air quality monitors on city parks vehicles, and we're working with the city to develop an open source R toolkit using the methods that I developed that I just showed you, so that the city can run some of these analyses themselves on an ongoing basis. We also have deployments in other cities. In Sparwood, in British Columbia, it's actually a coal mining city. In Stockholm, we just have a pilot in Beirut, where we're looking at the impacts of generators on air pollution in the city. We also successfully got a small NIEHS pilot grant to validate the use of low-cost sensors in mobile monitoring. Essentially this summer, I was driving around Cambridge in a Tesla with our air quality monitors on the roof and a higher quality monitor in the car to sort of understand under what conditions, what were the factors that sort of were responsible for the agreement or disagreement between between these measurements. And I'm happy to talk more about our findings, about these findings later. I'm going to skip this. And I'm going to go straight into talking about the policy relevant applications of all of the methods that we developed. So one of the things that, I have a partnership with the University of Nairobi. And in the summer, we actually deployed mobile air quality monitors on bodas or motorbikes in the city. And we started this pilot, and then COVID happened. And then we were luckily able to continue this pilot for about a month. So we had a month of data before the pilot, before COVID happened, and a month of data after the city had implemented a curfew. And we wanted to evaluate if how COVID-19 policies had affected the spatial variation of air pollution in the city. And we used different models to sort of extrapolate the mobile monitoring measurements to the entire city. And we tested the sensitivity of the spatial patterns to the models used, to the models used. We limited our measurements to the best possible data. And we did all of these tests to make sure that our findings were robust. And ultimately, we found that air pollution in Nairobi did not decrease uniformly. In fact, it increased in some of the lower middle class neighborhoods. And luckily, concurrently, there was an energy survey that was being conducted. And we found that the neighborhoods that switched from gas to solid fuels were exactly the neighborhoods where we saw increases in air pollution. And these neighborhoods were not the poorest of the poor. They was sort of one rung higher. And they were the ones who were most affected by loss of income during the pandemic and had to switch fuel. So we believe that this is why we saw the patterns that we did. I'm not going to talk to you about the sensitivity analysis, all to say that our results were robust to these various sort of analyses that we threw at our data. I've also another really important policy relevant application of collecting this PM 2.5 data is then evaluating the health impacts of PM 2.5. And the reason this is important in the US is because the national ambient air quality standards are updated every 5 years based on the latest possible evidence. The NAQS, or the National Ambient Air Quality Standards, are designed to protect the most vulnerable populations, the Medicaid population being one. So I have worked closely with a group at the Harvard School of Public Health to do the first study looking at the associations between PM 2.5 and cardiovascular hospitalizations in the nationwide Medicaid population. And the brief summary is that we actually found very strong associations, and the associations in the Medicaid population were actually higher than in the corresponding Medicare population, which was very concerning. I also have this paper, which is going to come out shortly, where we did the first study that looked at the impacts of air pollution on infant mortality in India, and we looked at the we looked at the sensitivity of these associations to the exposure assessment used, because right now different groups are coming up with different methods to derive these exposure assessments. And so we looked at a widely used global sort of PM 2.5 map, as well as one developed specifically for India by the Indian Institute of Technology, Delhi. And we found that the associations remained robust and were concerning. Finally, I hope I've convinced you that low-cost sensors and air pollution data is important. But as we develop these techniques for using low-cost sensors, it is really important to understand who counts air quality and whose air quality counts. Are the people who are using these low-cost sensors the ones who truly need this data? And so with Pat Kinney at Boston University, we looked at one of the most widely deployed networks of low-cost sensors, the Purple Air. And we asked a simple question. Are these sensors being used by Black and brown communities whom countless studies have shown really bear the brunt of pollution? Are they being deployed in more polluted neighborhoods than EPA monitors? Who are using these sensors? And unfortunately, the answer to this question is pretty disheartening. We actually found that sensors tended to be deployed in more white, more educated neighborhoods than neighborhoods with EPA monitors, and compared to the national average. They were also deployed in areas that experienced lower air pollution compared to census tracts with EPA monitors. And so this work clearly showed that there was a need to have policies to make sure that these instruments that we say can democratize air pollution data are actually achieving their potential. I'm going to skip this because I already told you the highlight. But I've been really fascinated with who are using low-cost air quality sensors. And although there have been case studies looking at specific EJ communities and looking at how those communities are using EJ sensors, we don't really know how the general public at large are using these devices. So I actually scraped Amazon reviews of low-cost air quality monitors, and I ran them through a topic model, a latent Dirichlet, an LDA model, to extract key themes from the reviews, just to understand how people are using these devices. And what I found was that although EPA, South Coast, the European Joint Research Council are spending millions of dollars in evaluating the different low-cost sensors on the market, making this information publicly available, most of this information did not seem to be reaching, at least the public that I found on Amazon. The same device had very, very different ratings. People were using their own sort of techniques and methods to evaluate the accuracy of these devices. And this is important because then they were making really important decisions, such as when to turn their air purifiers on, when to exercise, using the data from these sensors. So they clearly felt like there was a need for more education on, the uncertainties in the data from low-cost sensors. A very important topic that came out was wildfire smoke. Many people seem to be using these devices to detect smoke, to figure out when to turn their air purifiers on, etc. And such a finding can enable fitness of purpose sort of evaluations of these devices, because currently we're evaluating low-cost sensors in the market in ambient conditions, and we don't quite know how these devices sort of perform under wildfire smoke conditions. So this sort of major use case could trigger some of those evaluations. There were lots of interesting comments on what people wanted, what kinds of information people wanted from their device, etc. How does the public react to this air quality information? In order to further explore this question, I worked with Professor Siqi Zheng, who's an economist at MIT. And we collected air pollution in different transport modes on different routes in the city of Zhengzhou. And her team recruited a group of people to download an app on their phone, which pushed this data to them in real time, and evaluated how this information, which was presented to them in different formats, affected their decisions. And although I was not involved in the analysis of, what kinds of information best sort of incentivize people to make the decision to use public transport or non-motorized transport, I did work on the monitoring bit. And unfortunately, COVID sort of threw a spoke in our plans to really evaluate the design features, but hopefully now we can get back to understanding how the public reacts to air quality information. Finally, there seemed to be, when looking at papers that talked about environmental justice, there was lots of there were lots of papers that said in majority Black census tracts, we find air pollution to be worse. And similarly, during the COVID-19 crisis, the language that was being used, although not meant to, could seem to be vilifying certain communities. And so with colleagues in my department, we wanted to push the language used in urban planning and public health to talk about structural racism instead of race, as a category. And so we developed different metrics of structural racism in the US. And we found that when one used those metrics, the importance of race sort of diminished and became almost insignificant when evaluating associations between COVID-19 case and death rates, structural racism indicators, and race. And ever since this project, we've really been trying to be more careful about how we think about how we think about even talking about things like environmental justice. I want to get back to my first slide, the map that I showed you of all of those blanks, that entire blank space across in the continent of Africa. Now that I developed all of these techniques, done all of these sort of analyses, I had been interacting more and more with Kenyan scientists, and I realized that the map was just incomplete. Kenyan scientists have been doing so much great work in Kenya, and because that work tended to be published in local journals, it was just not being represented. And so I did a review of the air pollution work that had been done in Kenya. And I found that since the early 1980s, there had been 33 studies done monitoring air pollution in the country. And although those studies had been done in a limited time frame using different instruments, most of this work had been done in Nairobi. Yet across these studies, there was a lot of consistency in what the most important sources of air pollution were in Kenya. Highways. Kenya has some of the highest levels of black carbon in the world because of secondhand vehicles sort of being sent there and used by people. Levels in poor neighborhoods were horrible. And so all of this to say is that we have enough data to inform policy already, and we should be pushing for action. In order to understand how we can further recenter the knowledge the studies that have already been done, the knowledge that we already have, especially in countries in the global South, I have been bringing together scientists in India, in different countries in Africa, and sort of just listening to what they have to say about the various structures that make their work that make their work invisible, and what needs to happen for their work to be recognized and used in policy. So I would be thrilled if you would check out my podcast on decolonizing science with a focus on air pollution science. I have also done a lot of field work in Nairobi. And I went through Nairobi's old urban master plans. This is a map from the 1927 master plan. And I don't know if you can read this, but this is a map of wind speeds and wind directions. And essentially this plan says we are going to locate the White Highlands far away from these noxious industries in the east. And so the European quarters were sort of in the northwest of the city. After independence, the city is still segregated on the basis of class instead of race. And it is the northwest of the city that is still the cleanest. And so Nairobi was planned to be a city with the spatial variations of air pollution that we currently see. And I believe that there's a great need to connect urban planning and the history of urban planning with the current sort of spatial variations of air pollution that we see today. I've been trying to digitize urban master plans from other cities in the global South to make these connections more apparent, so that air pollution can be seen as something that urban planners need to tackle head on. I've also done many, many interviews evaluating the challenges to air pollution governance in Kenya, coordination between different government agencies was extremely important. Lack of incentives to hold industry accountable. I was also shocked to find that Kenya actually had a mobile monitoring van with reference air quality instruments. I took this photo during one of my field visits. I was shocked because no one ever spoke about this van. No one had ever seen the data from this van. And when I went to Kenya, I was told by the Kenya Meteorological Department that they basically owned the van, but they didn't own the data from the van. And they had to pay this company, SI Analytics, a certain amount of money every month, which they never had, to actually have access to their own data. And because of that, they sort of had never seen the data that they had been collecting. So I feel like when all of these challenges of the lack of data, all of these challenges need to be addressed. In all of these challenges need to be addressed. And whenever we think of air quality, I feel like the science has an outsized voice, but there are so many other things that need to be addressed for all of the data that we currently have to be leveraged to make change. I think I am going to stop here. I can talk more and more about the citizen science efforts that are occurring in Kenya and their promises and perils. But I think I've sort of given you an overview of my work, and I'd be happy to take any questions. Thank you.
Thanks, Priyanka. Well, I'll handle the Q&A. My life of you might have, but
I thought I'll let you do it.
Yeah, okay. We have one hand up by Karthik. Please go ahead.
Oh, you're on.
Okay, no. Hi, thanks, Priyanka, for that. Karthik Krishna, based out of Golden, Colorado, founder, CEO of Krish Energy. I have a few questions, and I will be reaching out to you via email just to set up another call if you're available. So fantastic work, and trust me, I have some great stories to tell you about the folks I've interacted with in New Delhi about the air pollution issue there. My first question is, I know you touched on gathering data and calibrating it and all that stuff, which is fantastic. And I know you just touched on it briefly in terms of the sources of pollution, whether it's wildfires or generators. Is that an area where you're going to increase your focus on, or do you know somebody that's doing more? Because you want to gather the data of what's wrong, but you also want to know what we could do to correct it, right? Any comments on that, specifically from an Indian scenario? Because I read a report, I think a couple of months ago, WHO recalibrated the PM levels, and whole of India is now considered polluted, which is crazy.
Yeah.
Sources?
Yeah, so actually right now, people do run models to and they tweak the models to evaluate what would happen in different policy scenarios. And there are some super complex models such as geochem, which are chemical transport models, but people have come up with simpler models. I know that Julian Marshall has come up with this tool called InMap that allows for sort of modeling the impacts of various sources. There are these tools available. Recently, Randall Martin's group at Washington University, in addition to coming up with estimates for PM 2.5, have come up with estimates for the different chemical components of PM 2.5, which sort of contain source information about sources, which are being used by researchers. I can't say more. If you want, because I don't know more, but if you're interested in Wildfire Smoke, Colleen Reed, who's on this call, is your person.
Oh, perfect. Is that with CU Boulder as well? Hi, Colleen.
Hi, nice to meet you. Yeah, I'm at CU Boulder, but Priyanka is at CU Denver.
All right, I will reach out to you. And I'll say this, trust me, this is something that I'm very passionate about. I've written some articles, and my company is looking at, I sponsored some projects at the University of Colorado Springs, and I'm looking to make some connections at Boulder too, and that led me to this event. I don't want, if anyone else has questions, please, cut me off and do that, but I can go on and ask a couple more if you allow me to.
Yeah. Colleen has one, and maybe then we can go back to Karthik. Karthik, sorry if I mispronounced you.
No, that's fine.
Priyanka, it's so great to hear about all of your work. You've done so many different projects in so many different places. And I was wondering, I have so many questions, and so we'll set up time to get together sometime soon. But when you were talking about the switch from gas to solid fuels because of COVID impacts in Nairobi, I thought that was really fascinating. And because I think that there's this narrative out there and it's using just the regulatory monitors mostly, I think, where you're not getting these spatial gradients within a city about how COVID, for the most part, was decreasing a lot of air pollutants. And of course, it depends which air pollutants you're looking at because of the different sources that we switched to. We stopped driving as much, but we still were doing other things. And I think what's really interesting about that case, and I would imagine, of course, context matters, right? Like in every location, you'll have different patterns and ways that this played out, but it's not surprising. I think what you're finding is really interesting. And you mentioned it related to policy. And were there any policies that were taken then by the Nairobi government or anywhere that to try and, I don't know if there's some sort of subsidy to allow people to continue using gas instead of solid fuels, or other things that were done to remedy the situation in terms of there's the income side of it as well as the air pollution side of it that played out, I'm sure.
Yeah, I mean, unfortunately, I don't think anything was done. I do think that bureaucrats were swamped during this time. And although it was actually a group in the UK, and I completely forget, that was sort of taking the lead on spurring these energy related policies. They were the ones who did this survey. I don't think anything happened by the government, but I do know that some NGOs came in to subsidize the use of solar cook stoves and things like that. So I know that there was some targeted interventions, but I don't think they were at a large scale. Yeah.
I think go ahead. You can
All right.
answer the next question.
I'll say this, you're welcome to just call me KK as well, my initials, if Karthik Krishna is too hard, but just putting that out there. Back to the question of sources, Priyanka, and I will say this, I wrote one paper in the Energy Policy Journal where we looked at sustainable energy transitions, in France and Brazil. And I believe, having published that and being cited a few hundred times, one of the key drivers for policy action is the right narrative for things. You want to have the narrative, and that's what connects and drives policy action. That's my opinion, and I'd love to hear yours too. And I believe just a lot of the environmental protection efforts right now are just so focused on climate risk mitigation and using carbon as a metric that somehow air pollution has just taken a back seat, which is very dangerous in my view. And India is a case study to prove my case, I would believe. And so that's why I asked the sources, because I believe the sources and the solutions, although there are plenty of overlaps between climate risk mitigation and air pollution mitigation, are different. And I want to give you an example of, if you want to use carbon capture technologies, you can be carbon neutral, but you can still emanate a lot of air pollution, right? So have you looked at the narrative? Have you tried to educate people on the differences between saying, I want to reduce carbon emissions to reduce anthropogenic global warming versus I want to have clean air? And there's a big difference people don't really understand, according to my view.
So I think it depends in different places. So I think like in Kenya does have a climate bill that was passed after 8 years of negotiation in Parliament, and they do have a climate secretariat. They don't have an air pollution secretariat. I do think that linking the two and showing how climate change mitigations also have air quality benefits is extremely important to link the two challenges. I know that people are working on it. I find that it's not the narrative, at least not the narrative in Kenya that is the problem. It's not the narrative in India. In India, like in Delhi, the sources are clear. It's the burning of fields to clear wheat, to plant rice. There just isn't enough time because of the use of GMO seeds during the Green Revolution, which had never been used in those areas, and suddenly were being introduced. And then farmers not really knowing when they could, and that just changing the ways, changing sort of the cropping cycles, which have led to the challenges that we see in India today. Not having enough time and therefore burning being the only option, really small farming fields, and therefore large tech solutions not being sort of financially feasible. And there's lots of work happening on how to make sure that those technologies become more widely available. There are lots of innovations in the financing world. So I actually would disagree about us not knowing the sources. I think we really know the sources. I think like it's the challenge is really in like coming up with intervention plans. And in Nairobi, because my fieldwork is in Nairobi, I'm most familiar with the case, and I can tell you what I have found. So the problem is, like, unlike the climate secretariat in Nairobi, there's no sort of air pollution. There's no sort of air pollution body. So different agencies have different roles, and they don't always coordinate. So although the National Environment Management Authority, NEMA, is responsible for upholding, Kenya actually has air quality standards, they don't have the capacity to monitor. The Kenya Meteorological Department has the capacity to monitor. Those two agencies have a very fractious relationship. A lot of it could be because of questions of who collects the money from the fines. A lot of it is who pays for the monitoring, who pays for the data analysis, and those questions have always historically been contentious when these two agencies have had to deal with each other. What has made the situation in Kenya even worse is the 2010 constitution actually devolved the issue of air pollution to the county level. And suddenly Nairobi City County was responsible for, according to the constitution, for actually upholding the air quality standards. But there are two people who work in the air quality unit in the county. There is no capacity to monitor. So coordination between these different agencies is extremely important. To make this even worse, there's a high turnover of top-level government bureaucrats, which makes having a plan, sticking to the plan, even more difficult. So I think everybody knows what the challenges are, but to actually come up with a plan to implement them has been extremely, extremely difficult.
Thank you. Adding to that, just very quickly, given that it relates to this, I think, when you were showing this monitor, basically the data not being used because they're proprietary to a company, is this a pattern that you think it's common around different parts of the world? Or
Yes.
I don't know, I'm surprised to hear that they wouldn't necessarily, that they might get some fund to pay for the monitor itself, but not the data themselves. So what do you make of all of this?
So it's clear that, this is a good business strategy for a low-cost air quality manufacturer to have. I think, like, if this had happened in the US, there would be there would be outrage. But because this is happening sort of in Kenya, it's sort of swept under the rug. We aren't talking about the financing mechanisms. We aren't talking about the fact that manufacturers are not required to make their algorithms or how their sensors collect the data open or transparent, which means that all of these sensors are evaluated in California, but no one knows how they actually perform in Nairobi. So what I have found, especially when I worked for the UN, is that everyone's peddling their sensors to the Nairobi City Council. They have no idea. They sort of believe what they're being told. And then no one knows how those sensors are performing in Nairobi. So there's a great deal, there's a huge need to hold those manufacturers accountable and to evaluate sensors in different environments, Kenya being one. But it's unclear how that's going to happen, because I think both the EU GRC and the US EPA have decided not to have manufacturers be transparent about their algorithms, but instead to come up with these very, very elaborate protocols to evaluate sensors, which has led to gaming of the system, because once you know the conditions under which these sensors are being tested. And in fact, with one of my interviews, with some of my interviews with people at EDF, for example, everyone knows that this is happening. But it's always been surprising to me that not more is being done about it.
Colleen?
And I guess it's kind of related to the lack of data. It's often shown those maps in air pollution world, right, that we don't have a lot of data for Africa and other parts of the global south. And your work where you identified literature that's maybe not indexed by Web of Science, but that's been done on air quality in Nairobi. Do you think that that's also the case for other cities across the global south, such that it would be possible to sort of, have a lot more information about air quality globally? from these other studies that have been done in the maybe more of the gray literature, I guess?
Yeah, no, I absolutely think that if I had a year off to do where I didn't have to do anything else, I would just do reviews of like all of the work that has been done, because I think there's so much that we're just unaware of. Like many reports published by, environmental agencies, some of them just the raw data, but it exists. And I just don't feel we're leveraging it enough. Instead, a lot of scientists are getting money to go there to sort of replicate what local scientists already know.
If I may, I want to jump in for one more.
One more, yeah, of course. Go ahead.
Yeah, on the topic about interdependencies between addressing climate risk and air pollution, I believe, and this may be this may come across as controversial or trigger some negative views from most people, but I'll say this. I believe if you look at a case like India, if you're saying, let's think about carbon risk mitigation or climate risk mitigation, and that will also address air pollution, that's a very indirect way of addressing this. If you make air pollution the front and center of your biggest environmental issue, then you're directly addressing the issue, and you may get the climate risk benefits as because they are interdependent. You will get the benefit of reducing climate risk as well, but you make air pollution front and center. That's my point of saying, and I've heard a lot of people, especially from the Western world, Western Europe and North America, you would say, address climate change, make carbon the metric, because that'll also help air pollution. But I say you have it upside down. I say this is not something that's going to happen even a few years down the line. This has been happening for the past decade or so, where you have children facing health risk, and you have mental issues coming from prolonged exposure to air pollution in cities like Delhi. And I just think the narrative has not been addressed properly from the policymakers. And I also want to add this to you, Priyanka. One of the issues with folks in New Delhi is there's a lot of peer pressure to just do what Germany says or do what California does and try to say we are also there, instead of saying our issues are different, we need to address this differently. Any comments? I'd love to hear, but that's my view, and I will reach out to you as well.
Yeah, no, I mean, I think people are trying to I do think there are lots of people doing good work, like really good work, trying to tackle air pollution. I think, as I said, it's extremely difficult. You're right. I think people, and I've seen this in Nairobi as well, like the reason why there is a climate secretariat is because all of these countries have poured in money into climate mitigation, and there's no one sort of supporting air quality efforts. And in fact, the Clean Air Fund came up with this amazing report where they actually showed the distribution of money geographically to work on air pollution. And I think there was like less than 1% of global money on air pollution was going to, say, the continent of Africa, less than 1%. So clearly there's a greater need for more funding for air pollution related efforts. But that's not to say that there isn't stuff happening locally. It just needs to be better funded.
Thank you.
Very much. Any final question? We have time for one more question. Okay. Well, if not, we can adjourn. Just before that, just a quick reminder. Yeah, thank you very much again, Priyanka. Sorry, thank Jeannie. Yeah, thank you very much again. Very interesting, broad talk, as well as very interesting discussion of some specific issues to the political economy of air pollution in Kenya. Both very appreciated the global and the local view that you provided in Nairobi as well. Just a quick reminder that next week is their last seminar in our series for the fall semester, and Leslie Root will be presenting on measuring fertility in a changing United States status, challenges, and opportunities. So thanks again, Priyanka. Really appreciate your presentation, and hope we can meet you in person sooner rather than later.
Yeah, likewise. Thank you.
Thanks, everybody.